This is my patient Josh. Josh came in with a left ankle, left hip injury. He stepped out of the car, stepped into a pothole. His body went one way and his foot stayed.
To my chest, no problem. Like trying to put too much pressure on this one hurts, but I know I can do that.
I've edited this exam way down, but basically Josh has weakness in his quads and in his left hip and his left hip flexor. What we can see with this muscle test is that Josh has pain in his left hip flexors, both through muscle testing and when he was trying to lift his knee in the exam. The tuning fork is used here to see how Josh perceives information through vibration. And he had pain on that left knee prior to the adjustment. Then after the adjustment, we went back and rechecked, and it was less painful.
Like that's almost what I feel like. Yeah. It's a little tender, but not as much as it was like resonate. Yeah.
When I put an input into the body, and that input could be chiropractic, stretching, massage, trigger point therapy, whatever it might be, and when any practitioner, physical therapist, massage therapist, chiropractor puts an input into the body, those signals go into the body, but ultimately they go into the brain. Then the brain deals with those messages and then gives an output signal. 10% of the brain's output deals with muscles. You've heard the saying in the past that you only use 10% of your brain. It's true that you only use 10% of your brain to move your body, but you use 100% of your brain. The other 90% of the brain is dedicated to your autonomics, heart rate, blood pressure, peristalsis, kidney filtration, all the automatic controls. I'm measuring the muscles and or doing some type of a balance test. So that's me measuring the output. So I'm going to put an input in and measure the output. When I adjusted the ankle, that was our input. And then we went back and checked the left hip flexors. That's the output. There was no change. So that tells me that didn't have a real significant impact on that hip. It might have no doubt helped his ankle, and had I did some other tests that might have shown up, but I'm trying to get his hip fixed. Then I went and did a cerebellar exercise, and then once again went back and rechecked the left hip flexors. It had no impact.
Push out. Go. Okay, there's our problem.
All right, so let's slow this down and analyze what happened. When I had Josh turn his head to the right, he should have had facilitation of the right glute med. So the fact that Josh's right hip became inhibited with the right head turn, this is abnormal. So at this point, I know he has some type of dysfunction in his cervical spine.
Head right. Push out. Yeah. Bend this knee. Don't pull. Alright, there we go. How's that?
That's a trip, yeah. That's a trip.
This is weird. Just, I want you to think about falling.
Okay.
I want you to just think about how your foot went in the hole and your body went one way. I want you to think about the pain.
This is some simple emotional work in the attempt to remove any negative emotions associated with the injury from Josh's body.
All right, we're not done, but I want you to go walk and see how you feel. Same, better, worse.
I feel like I put more weight on it. Weird. This actually kind of feels another.
Let's try your test again. How's it feel?
I feel like exactly like what I needed. Like I needed to be popped. Like it's a little sore. Yeah, it's sore. But not like when I was standing on it like this. Like I could feel it resonate.
Okay.
And right now it's kind of like I feel like it's healing itself.
Let's go do 3 more. Actually, let's do this back.
While I'm a big fan of chiropractic neurology and muscle testing and massage and all these things and all the trick stuff that we can do in the office, sometimes there's nothing better than a good old-fashioned elbow into muscles, breaking up scar tissue, adhesions, helping reset the proprioception and gang of the glenoid tendon organs. So this is very painful for Josh, there's no doubt, but it's also very therapeutic.
Hurts so good, Doc. Hurts so good.
All right,
Jeez.
go walk. See how that feels.
close to getting there. Like where before, dude, I couldn't even like manage. Like I'd have to gimp along.
Try your heel to toe just to see how you're doing. There you go, young man.
Doc, you're the man.
Thank
It's a
you.
miracle.